You can share the video later. Okay, I'm ready. You can start anytime. I'll keep my video stop, huh? So you can. I'm ready, huh? Anytime you can start. Everything is fine.
Okay, we start sharp 7.
Yeah, okay. One question. People can chat, right? People can chat and ask questions. Somebody should take the chat questions and later direct to me if I miss them.
Very good evening to all of you. You are joining with the fourth session of the Pandemic Scare Rise from Ashes Disaster Management webinar series organized by 2016-17 batch Department of Business Management, Faculty of Management Studies, Sabaragamuwa University of Sri Lanka. Today, our topic is HBS Case Discussion on COVID-19 Global Shutdown. In this webinar, we hope to discuss the current pandemic situation in disaster management perspective. First of all, I would like to invite Koshila to welcome you all for today's session.
Good evening, all of you. I warmly welcome our resource person, Mr. Chaminda Hettiarachchi, co-founder and director of Lanka Foundation. And I warmly welcome Dr. Rasika Priyankara, head of the Department of Business Management, Disaster Management subject lecturer, Mr. Achinta Ekanayaka, and all the other lecturers, and also all the other participants. Hope you enjoy this session. Thank you.
Thank you very much, Koshila. Today, our guest speaker is Mr. Chaminda Hettiarachchi, co-founder and director, Lanka Foundation, GDE Limited, a social enterprise working on Industry 4.0 technologies, including 3D printing for socio-economic development in Sri Lanka. And Mr. Chaminda is also the CEO, Managing Director at DIL Consultancy, a research and management consultancy company in Colombo. He teaches project management, strategy, and e-business as a visiting lecturer for postgraduate programs at University of Colombo, University of Moratuwa, and Kothalawala Defence University of Sri Lanka. Without further delay, I cordially invite Mr. Chaminda to conduct the session.
Thank you very much. Can you hear me?
Yes, we can hear you.
Let me immediately share the screen before starting. Can you see my screen?
Yes, sir.
Okay, thank you very much. So I'm very happy to come to this session. It's really interesting. In fact, it's my first kind of formal interaction with the University of Sabaragamuwa in any means, even though I've been teaching and doing work with other universities, most of the universities. As already introduced by Netmini, I have been teaching from 2005-06, mainly to Colombo MBA, also Moratuwa and Kothala Defence University, but mainly to Colombo. But actually, as a decision I have taken in 2007, I normally teach only at postgraduate programs because I want to keep my focus and I have some other work to do. But sometimes I like to talk to, anyway, undergraduates are the most exciting people to teach because they will remain, my, loyal students and former students for long years based on my experience. But I normally, do interactions and do some, guest lectures only for, selected subject of my interest. For example, Industry 4.0, 3D printing. These are new subjects I'm trying to, populate in Sri Lanka. So in such situations, I do kind of teach and do visiting or guest speeches. But disaster management has been, my long-term interest, even though I was not really active in that for a few years because I was very active at the beginning after tsunami. Because I found it's not very common for Sri Lankan academics to be in that field. I have seen when I work internationally also, this is mainly done by either government civil servants or mainly military. So it's very interesting to know that you have part of your curriculum disaster management. I had actually congratulate on that because it has disaster management. It's called in different subject terms like disaster risk reduction, disaster management, disaster prevention, and different terms. But it's really a demanded subject and expertise area, not only in Sri Lanka but globally. But being a Sri Lankan graduate or Sri Lankan manager, you will have a lot of opportunities, because Sri Lanka, of course, is known for not only for disaster but also managing disasters very well. Probably after tsunami, and also we have very unique disaster profile, because we are an island, we are a small island, and we are close to a very high, large population, and so we have multiple levels of disaster, and so there are opportunities for international collaboration as well as making the case for Sri Lanka. So congratulations for the staff members who are teaching it and introducing that to the curriculum, as well as for the students who are studying it. Okay, so today I'm going to talk about very commonly known and current problem of COVID-19. It's not exactly a disaster; it's more like a health disaster or epidemic or pandemic. But we will focus this mainly from disaster point of view. So thank you again for welcoming me. Now, the objective of this session, there are two main objectives. One is to look at COVID-19 and understand what has happened up to now and what's going on at the moment from disaster point of view, and to take this as a real life case or real life situation, because we are all affected by this very unique and very large scale global disaster. And also now, I know when I was talking to your organizers, I was informed that even though you are studying disasters, you are not still in the early stage, or you are not like full-time disaster management students. So I understand some of the limitations, and also I normally teach to MBA program, so it's a postgraduate. So I had to kind of scale down and focus this at undergraduate level. However, the idea is to discuss this COVID-19 situation mainly from Sri Lankan perspective. So there are two elements. One is to look at this as a global situation, global pandemic, and also look at this from Sri Lankan point of view. Okay. Again, now when I had different options to present, but I decided now I will go with my MBA style of teaching and MBA style of delivery. That is. Learn something through a case study. Now, I don't know whether any of you have been to my classes. I have seen in your department there are people who have done MBA from Colombo. Anyway, if you have been to any of my classes, I have been teaching, and in fact even kind of pioneering of case method teaching in Sri Lanka from 2005. This is a unique interactive way of teaching, started and popularized by Harvard Business School. I'm an alumni of Harvard Kennedy School, so I try to push this in Sri Lankan universities from 2005. And so all my classes are done with case method. Now I have selected this very new case. It's I think in Sri Lanka this is discussed for the second time. First time I did this as a pilot test in my MBA project management class, maybe May, when it was like released, but it's very new because I checked online also. There nobody has still done this in public. So you will be like one of first group of students to participant to get some ideas about this case. It's a very unique and even advanced case. It's not only about disaster management, it's about economic management, about global management, a lot of subject matter, but we will look at this from mainly from Sri Lankan perspective and disaster management perspective. Okay, let me also show the case study. If it is my profile. To hold for Now the importance of discussing a case or introducing a case here. Stop sharing. That I could have done like a my own presentation, but I thought now academically not get this pandemic is documented well. We are a lot of videos and other stuff, but this is one of first academic documentation of the COVID-19. So it will be like one of first, but of course there will be a lot of future research papers, projects, cases on COVID-19. But maybe this is like first global one. It's actually a little bit longer one, but it's very rich in content and in the focus. So we are going to talk about this in a very kind of simplified way, not like a case discussion class, but I refer this as the main document. I'll come back to this later. Okay, so that's the context. So again, I want to highlight now, this is not a typical case discussion we do in an MBA class. And it's more like a lecture based on a case, right? And the second thing is, I tried my best to scale down this to undergraduate level, because my experience with undergraduate level has been very old. So maybe you are more advanced than I assume, but I make it very simple. But if I have kind of not into your standard, let me know. Maybe I apologize for that from the beginning. All right. So you all, I'm sure, know that. Let me check if there are questions you can. Okay. Okay, good. So we have people connected from other countries also. Very good. Welcome. Right. So COVID-19, people know it's the abbreviation, but the meaning is coronavirus disease 2019, right? Some of you already know that it was originated, believed to be originated in China, first identified in this Wuhan, Hubei province in December 2019. There's a debate about how this was originated, who was responsible, but that's the official version. So that is why it's called COVID-19, because started in 2019. Now, World Health Organization declared this as a global emerging threat only in March. There's also complaint against that, but now we can, like out of China, it was considered a serious threat only from May and onward. And but even though started in January, only 3 months ago, by maybe 4 months ago, by end of April it was active in almost out of 205 countries, it was active in 187 countries. You can see it's a very global in terms of its spread and its volume. Now we have some experience with coronavirus diseases. For example, there was SARS and then MERS, and there are a lot of such kind of coronavirus related epidemics or pandemics. But if you look at the impact, if you look at the scale on disruption it has brought to the world, this can only be kind of considered or make parallel with so-called Spanish flu, which happened 100 years ago, slightly more than 100 years ago. Maybe I thought I just wanted to you to just look at what happened 100 years ago, and as a result of that, how world changed. So maybe we are expecting something similar, of course, in a different context, but something similar changes, history, social changes in the world as a result of COVID-19. So we'll watch this very small video introducing Spanish flu 1918. You have tell me if you see the video. Huh? It's not yet coming, but otherwise I have to go back to the URL and do it.
We don't see the video.
Yeah, still I think it's not open. Can you see now the screen?
No, it's only the
okay.
one of the slideshow.
All right. So that means I had to stop, because I think this is a common problem. So let me.
It was a pandemic of influenza.
That now you see, right? Now you see my video, right?
Yes, sir, we can see now.
It was a pandemic of influenza, that struck in the early months of 1918. It struck in, we generally say it struck in 3 waves. So there was a first kind of mild wave in the Northern Hemisphere spring of 1918, which receded in the summer or late spring. Kind of all the dates depend on where you were in the world. And then there was a second wave which erupted in the latter part of August. And receded towards the end of that year. And then there was a third wave, which was sort of intermediate in severity between the other 2, which emerged in the early months of 1919. We think it infected about 500 million people, so 1 in 3 people in the world alive at that time, and that it killed 50 million of them. Those are the current estimates we work with, and the death toll could have been even higher because there was a big problem with underreporting at the time. They didn't have a reliable diagnostic test. Undoubtedly, it was a concept, but to put in place a socialized medical healthcare system, socialized healthcare system, is not an easy thing. You have to find a way to pay for it. You have to reorganize all your doctors and the way that you deliver healthcare. And so no country had really got around to it yet. And I think that the pandemic is what gave the stimulus to do that, because there was a realization that a pandemic was a global health crisis that you had to treat at the population level. You couldn't treat individuals, and you couldn't blame them. There's no point in blaming individuals for catching an illness or treating them in isolation. So that was the stimulus. And you see from the 1920s countries, Russia was the first, but then followed by Western European nations, putting in place these socialized healthcare systems. And along with that comes epidemiology, the search for causes and patterns and causes and effects and patterns in healthcare and in illness that is the kind of cornerstone of public health. If you can't see what's going on in a population in terms of health and ill health, then you don't know what measures to put in place. So the 2 go together. And so as a result of that, what happens is that the baseline health of populations starts to become much more transparent, much more visible.
Okay. So you might have noted now that Spanish flu 1918, which happened 100 years ago, changed the world. Of course, 500 million, that time 1/3 of the entire population of the world got affected, and 50 million people died, very high compared to us. Of course, you have to understand the context. There was no internet, no even television, no democracy. It was just before the First World War. So there are a lot of other issues, no vaccinations. But then as a result of that, the idea of universal healthcare and all, a lot of changes happen. We don't want to go into detail, but that's kind of reference the world is making with COVID-19. Now, even for the COVID-19, there is no vaccine. No? This is normally the case with a lot of other such virus diseases. So, but now there is a global race to find a vaccine. Many countries are now trying to develop a vaccine and some other treatments. However, based on the current estimation, we will not be able to get particular countries like Sri Lanka, because vaccines need a lot of time to do a lot of all these regulatory things and stuff like that, testing and all these things. But it will take another at least let's say till mid 2021, maybe July, August. In the best case scenario, we will not have a vaccine till then. So you have to survive without a vaccine till then. Now, a lot of diseases are, controlled by vaccinations, like we have this triple and all these things when you are young. This is to avoid them. Now, as a result of that, you have to do a lot of prevention, because if you get the disease, there's no real cure, and therefore, what countries did or what countries are doing is they're doing different ways of prevention and controlling of the virus. Viruses are very much, very quick to spread among people. So, measures like social distancing, lockdowns, or we call in Sri Lanka as curfew, and also concepts called herd immunity. I will talk about them a little bit later, followed by different countries to slow down the spread. Now, since the case is a little bit older, and this is changing every day, what's happening in the world. So let me just introduce you the global situation in terms of number of people and affected and deaths and stuff like that. I have to again open this and the share. Okay, just a minute. Okay, right. So this is like worldmeters.info is like, I know it's an information aggregator, getting information from multiple sources, and they update. So you can see now more than 13 million corona cases across the world, with more than 500,000 deaths and number of 8 million recovered. Now, if you do any research or any further studies, this is one very good site. Now, here you can see you can order this in different ways, but now its default is a total number of cases. So you see US has more than 3 million, Brazil is more than almost 2 million, and India, our neighbor, has almost 1 million. Now, this is interesting because countries like India or even Brazil got this very late. These are not the countries where the coronavirus was originated. Now, China, it was, even though it's some people even call Chinese virus, now it's under control to some extent, and it's also not this is Chile, but China is even very below, like 25 in terms of people. Now, to get idea about where are we in terms of number of cases, we are out 107 out of how many countries? Maybe 200, 215. So we are not really very well in terms of number of people affected. We are like mid. You can also change. Let's say, for example, if you look at total deaths, make it smaller. So you can see these are the countries, the no deaths. Now there's one. Now total number of deaths. So where are we in Sri Lanka? We are also again a little bit better in terms of number of deaths. So likewise, you can compare all the countries with all these indicators. Now, important thing is, for example, you can order this one, and as well as you can compare total number of cases per million population, because all the countries don't have same population size. Now, if you look at that, now Qatar is affected more because per million, the number of cases are very high. Now we will see where Sri Lanka is, 20 million. So when you have time, you can just play around. So we are maybe low because out of 20 million, only 2,000 affected. So I can't find it here, but it's here, right? So basically, it's 125 million cases per million people, right? So likewise, you can compare and see how we are doing compared to any other country. So that's one global situation I wanted to show you, the aggregates. And can you see my screen now? The PowerPoint? No, right? No, right? Okay, I had to come back and. Okay. Okay. So that's happening in the world now. People who want to learn, I'm sure you already know some of you know the Sri Lankan situation, but for the completeness, I will also show you now. Now, coronavirus or COVID-19 is a it's a pandemic, and in this kind of situation, people get panic, and they always there are a lot of rumors, a lot of fake news. So please go and check the real situation. Of course, we can also criticize the government and the agencies handling about accuracy of the data, but now this Ministry of Health is very reliable, and they have very updated data. For example, this is Health Promotion Bureau is very active in updating and sharing information. You can see a lot of daily cases, how it's compared with other countries, global Sri Lankan mortality rate. For example, we have a low mortality rate. Okay, so this is like the Sri Lankan situation. There are a lot of information you can check. Can anybody tell me any reason why our mortality, that is the number of people killed from COVID-19, is very low? For example, it's less than 1%. It's now even less than 0.5%. Whereas in countries like Italy, it was like even 10%. Out of 100 people got sick, 10 people died. In the US also it's higher. So any reasons you think, you know, why we have low number of deaths? Anybody? Just some guesses or any knowledge? You can unmute your mic and speak, or you can type if you know the answer.
I think it's because we identify cases very at the very early stage, before coming it very too dangerous and uncontrollable situation.
Okay, say for example, when you identify a case, if you don't have a treatment or vaccine or any treatment, how can you kind of control deaths? By controlling, by quarantine, or by keeping people separated, you can reduce the spread, but you can't when person get affected, how to avoid the guy get killed or die. You are right to some extent. That is a possible case, because when you get the person identified early that this guy is COVID-19 affected, if you can immediately send them to the hospitals, then there are some treatment. You can take care of the person, because the person get killed because there are complications, right? That's one reason. For example, now why in countries like Italy, a lot of people died, because you get people sick, but there are no enough hospital beds to treat them. So either you have to stay at home, or even if you get guy to hospital, there are no ICU beds. So that is also a valid point. We didn't go to that level. This is called threshold, infrastructure threshold. If you pass the threshold, the number of deaths become very high quickly. However, now in addition to that, there are some other explanation. For example, if you heard of BCG vaccination, now Sri Lanka is one country which practice BCG vaccination. I don't know for what reason they do this. This is for some other virus diseases. So we get that BCG vaccination when we were very young. I think when we were born in the hospital or some early stage. So as a result of that, people say there is a immunity built from that to a coronavirus. This is not yet proven, but that's one reason. And of course, there are other arguments that people in the colder country get more sick compared to South Asians or brown people, but these are not sound, still proven. But there are now you can see the number of deaths are still very low, and also number of people who are extremely sick in Sri Lanka is still also very few. However, you should also know this is not affecting everybody same. Now, if you are having a chronic disease like heart conditions or diabetic, you will be more prone to get complicated. Or if you have less immunity system, and if you are older, about 70, there are different parameters. These are public information available, you can see. Yeah. Now, just to quickly say, now maybe a lot of people in business management or in science think you should not really care about COVID-19. It's a disease. It's only medical people should learn. That is actually not the case. That is what I also thought at the beginning. But any pandemic or any epidemic has two elements. One is the medical side of that. Of course, to do that, you have to be a doctor or health professional to look at their complications, medical terms, and all these things. But then there is other science, for example, mathematics, because this is about aggregates, numbers, people, a lot of them. So if you have a good understanding about mathematics, statistics, populations, likewise, then you can understand and apply your management knowledge to understand and even get some conclusion. So that's what I have been doing, because I mean, in my Facebook, I made a post like, every Sri Lankan should now think like a doctor as well as an engineer. Doctor in the sense, you should learn practices. For example, washing your hands, keeping your mouth closed, and how to be health, how to practice health is, you can learn from doctors, because they are normally very much trained to manage their practices. So that's something you can learn from them. And engineers or mathematicians, you can look at modeling, you can look at population distributions, and all these aggregates. So if you can analyze those aggregates, you can also get some ideas. Now, to understand COVID-19, you need both skills, but anybody, particularly with people with business background, can easily do that. This is same with disaster management, right? Disaster management, it has its own scientific dynamics, as well as it has aggregates, number of people affected, displaced. So anyway, the point I want to say is, whether it is virology or epidemic, or whether it is disaster management, you have to think multidisciplinary. Okay. Now, World Health Organization is the main, organization who is dealing and who is making, a lot of directives and advising to the government. But they also have very interesting, very rich data. Let me just also show that one. Sorry. If you go to WHO website, you can get a lot of information about the virus, how it's evolving, a lot of new ideas, advice, things like that. And maybe very quickly, I'll show you. I'm just sharing or talking about them in a larger scale, because I put high emphasis, because people who want to study further, these are the site you should look. Okay, so this is World Health Organization. It's very rich in terms of information and knowledge. Let me share it. Okay, very quickly I'll show you. For example, there's a problem with the connection, but I will continue. Now, for example, let's say we'll look at how it's evolved over the period of time. I will look at cumulative cases, also cumulative cases here. So this interactive map, starting from January to today, you can see from here different countries, how the bigger the